So welcome, everybody. Good morning. And this is our initiative-led media briefing. The County of San Diego Health and Human Services Agency, Behavioral Health Services, utilizes primary and environmental prevention strategies and actively engages the community, key stakeholders, and the public health and public safety sectors to reduce a variety of harms and problems related to substance use through three major countywide prevention initiatives. The Binge and Underage Drinking Initiative, which is managed by the Institute for Public Strategies, the Substance Use and Overdose Prevention Task Force, which is managed by the Center for Community Research, and the Cannabis and Public Health Initiative, which is managed by the Center for Community Research as well. Today's training will focus on contract updates, themes, messaging, and social media. The session is being recorded, and if you have questions, we will provide time at the end of each initiative update for them. So I will be starting off this morning. So my name is Joe Eberstein, and I facilitate and manage the Cannabis Public Health Initiative, formerly the Marijuana Prevention Initiative. As I said before, we have a behavioral health service countywide prevention system. We have 6 regional prevention providers, and we have 3 initiatives. One focuses on alcohol. The Substance Use and Overdose Prevention Task Force focuses on fentanyl and meth. And the Cannabis Public Health Initiative, which isn't updated on the county website, focuses on Delta-8, cannabis, CBD, and everything I'll be talking about today. I do want to talk a little bit from a contractor perspective. If you are a regional provider or if you are an initiative that is funded by the county, then I suspect that you received this contractor information notice on September 21st, 2023. The next few slides will summarize the information that BHS shared with us September 21st. The communication and messaging themes for substance misuse prevention programs, and a little Q&A communication and messaging themes for substance misuse. Some of the policy and structure changes that we saw from this information provided by the county was a transition from media advocacy to public health messaging. Now, we will be planning on inviting our county core at a later date to explain what the difference is between media advocacy and public health messaging. Requirement for the BHS media event approval form for media advocates and activities, public health messaging as the primary media activity for regional providers, and a reminder, all public health messaging must include indication of HHSA funding in all public health messages. A lot of this hasn't changed from previous contracts. So what is public health messaging? Again, gleaned from the information that was provided, aimed at educating on health risks and protective factors distinct from media advocacy's agenda-driven use of media. Role of policy change, and again, you will see all of this information if you are a contractor in that notice. There are also different ways of submitting now for approval, and I believe all of you have gotten those notices as well. For any questions about your particular contract, you should contact your core. I'm not sure, I know we all have different cores, and they can clarify this for you, what this means for your particular contract. So moving on, initiative contract and messaging updates. So our initiative, the old Marijuana Prevention Initiative, is no longer there anymore. It doesn't exist. It is now the Cannabis Public Health Initiative. We have an amended contract as of the 23-24 fiscal year. And that amended contract includes rebranding of the initiative, which we have completed, designing public health signage for marijuana retailers, which we have submitted to the county, and then designing a public health resource library, which we have built into the new CCR website. CCR also has a brand new website, and we have rebranded earlier Marla's contract, SUOPT from PDATF MSF, and we also have CWMA and evaluation located at that CCR website. As of fiscal year 24-25, CPHI develops a media messaging proposal as opposed to media work plan. The media is as directed by CORE. We no longer have a set number of media deliverables to accomplish. We used to have 4 print media pieces and 2 news events a year. Now, SUD media messaging themes and events. We will be releasing new data through our CPHI data snapshot. This is still going through the approval process. This is a nice snapshot of ER visits, poison control, trends in use among teens, perception of harm. The good news is we have seen a decrease in past 30-day marijuana use all the way going back from 2014-15 to today. So that's according not only to chicks, but monitoring the future. We also have rabies children's numbers. As I said in many meetings, the issue of child poisonings is not going to go away. And I know the county has posted several social media posts about safe storage. I think this is one of the areas that we can continue to do media on. And if anybody needs more information, they can contact Dr. Natalie Lau. She's done a lot of media and she's done a lot of presentations, and she can speak about the data that she's provided. We will propose a news event to introduce the new cannabis signage. I am going to propose this in our proposal that we have due May 31st when our contract is up. Because I think it's an opportunity to have some of the experts with us at the news event who designed the sign. It was designed from a researcher and medical standpoint, why we picked the specific items to put on those signs. We, along with the KLT, developed the information in the sign, but the county is going to design the actual sign. It should be ready for print in either June or July, and hopefully we can get these into the 5 existing cannabis retail outlets and unincorporated. The issue of synthesized hemp Delta-8 products continues to be an issue, and I know that we're going to have an upcoming synthetic drug work group meeting. Here's the information on that. If anybody wants to join and hear about what's being sold in some of these smoke shops, we're going to be getting a law enforcement briefing. SAY is going to talk about the issues that they see and the environmental scans that they conducted. And they're going to be sharing laboratory results from products that were purchased in smoke shops. I think it's going to be a very eye-opening meeting. So April 30th at 10 a.m. We have recently invited TREADS, Training, Research, and Education for Driver Safety, to be a member of our key leadership team. So if anybody needs information from TREADS, contact Leslie Phillips or Jonna Johns. They have information in English and Spanish. And we know that this year, this summer, we're going to have all of these events again that can create a problem with driving. Now that we're fully open, COVID and the lockdown is gone, we're coming into Memorial Day, 4th of July, Pride, Comic-Con, Labor Day. TREADS is working on getting their virtual 45-minute training translated into Spanish. So that will be another resource. Social media and resource update. I want to offer some tools related to cannabis. We use social media primarily with CWMA to increase attendance at events, share data, and connect people with resources. Isaac has some excellent research-based posts. The International Academy on the Science and Impact of Cannabis you can visit isaac1.org and join their listserv. Also, the Prevention Technology Transfer Center Network has events and resources. SAMHSA and the CDC have excellent social media messaging. Whenever we put a post out, we want to direct people to resources. We just don't want to put bad news out there and then have everybody hit a brick wall. So share the access and crisis line, 888-724-7240, 988 or 211. Some other resources for collaboration. If you need any technical assistance with social media, contact me, contact Sarah at CWMA. The Cannabis Public Health Initiative has a YouTube account with videos that can be shared. And again, don't forget those holiday drug driving awareness campaigns centered around these events. Also, don't forget LinkedIn as a source of social media. They're one of the few social media outlets that allows you to post a PDF file. Believe it or not, it's very difficult to post on Facebook a PDF or on X or any of the other social media, or at least I haven't learned. I want to share some excellent posts that were put on social media pertaining to Alcohol Awareness Month, April. SAMHSA did some great work, so did the CDC. CWMA put out some social media about intoxicating hemp products. And I've seen some other of our regionals do the same. Here are some other examples. Isaac had a training about drug interactions, and then, you know, some good posts about the cost of from taxpayers and public health effects from alcohol. Here are some really good posts from regional prevention providers, say Turn Behavioral Health, IPS, Vista Community Clinic. What I've noticed is posts that have people in there generally get a lot of views. And I think if you're going to do social media, you have to interact with people. You should like, follow, and share people because they will do that in return. Posts, again, that have pictures, inviting people to events. It should specify whether or not you have childcare, language services, food available, parking. And if you're sending people to a big college, please specify what room they're in. You know, if you just say, well, come over to Grossmont College, you know, somebody will be driving in circles for a lot of time. The internet is filled with this month and this week, and it can be overwhelming. You know, April was alcohol awareness, September is suicide awareness, short videos are popular, and don't forget linked. Available opportunities for collaboration, again, March, National Alcohol and Drug Facts Week. May is coming up, 12th to the 18th, which is National Prevention Week. October, we have Red Ribbon, all of the holidays, prom and grad season. And I want to also point out some of our CWMA social media. We have a presence on YouTube, Facebook, Instagram, X, and our CCR website was just revamped. Here is the cover page. We're very proud of this. The Voices of Hope series that Mala is going to talk about is on there. News media, videos, drug driving resources. So I am going to escape out of this. I think we'll go to Marla next.
Thank you, Joe. So we're going to go to the next slide. Next slide, please. So a lot of this is going to be stuff that you guys know, and just kind of a reminder, we're no longer PDATF and MSF or the San Diego County Substance Use and Overdose Prevention Task Force. What I have found, the transition has been very smooth. People have really gravitated towards the new name, and I think they've truly forgotten the old name. So SUOPT has really grabbed on, and we have eliminated the two initiative silos and combined it into one silo. Like Joe's initiative, my initiative of public health messaging, no longer media advocacy, I'm going to tell you my core very much looks at this. And this is a very important factor. So as you do media events out there and you are incorporating some of the stuff from SUOPT, they very much want us to lean into a public health messaging, no longer media advocacy. It kind of goes down with a bullet further down. They really want us to lean into treatment, to eliminate stigma. The words matter. Our harm reduction strategies, appropriate with every age group. So harm reduction means something different based on various age groups. And then when it comes to methamphetamine, they no longer want us to use the word meth. That gets corrected at every single thing that I write. It needs to be methamphetamine. Substance use, no longer drug abuse. And then no longer crime-free multi-housing. They want us to lean into treatment options and approaches. And then like the CCR website, our SUOPT website is just filled with just a tremendous amount of resources for you. So I encourage you to go onto the new SUOPT website and take some time and really navigate through the website. Next slide. So some of the themes and events that are coming up, we have our Take Back Day on October 27th. Our National Fentanyl Awareness Day is on May 7th. Just so you know what the initiative is doing, we are putting out a media advisory, and we have quotes from our co-chairs, Summer Steffen and Dr. Eric McDonald. We also received a quote from Dr. Luke Bergman, director of our behavioral health, and talking about Fentanyl Awareness Day. But we were also taking an opportunity, and you'll see this in another slide, to introduce our interactive web map. And so I'll hold off on talking a little bit about that because I do have that in a different slide. World Drug Day is June 26th, if anybody wants to work on an event on that. And then I think what's really important is International Overdose Day, Awareness Day. It is always on August 31st. In the past, we used to put signs that identified the drug that was in the individual at their time of death. Now we just put purple flags. Purple is the color for International Overdose Awareness Day. But because it falls on a Saturday and it falls on a Saturday of Labor Day weekend, we are moving the event to Thursday, August 29th. I say at 8 a.m. The press conference will start at 9 a.m. But I will be sending out an email to all of you. And what we really hope this year is that we can get all our prevention providers down there with their tables and their information. We do get some public traffic, but what we have found is we get a lot of media traffic. And we really want the media to see the good work that our prevention providers are doing throughout the entire county. And so I will be inviting you all to that event. And then October is Drug Awareness Month. So next slide. This is just a snapshot. One of our community partners asked us to do some information. It was actually going to the White House on juvenile overdose deaths. And so we were able to gather some 2023 data, even though the 2023 report card is not finalized yet. There's a lot of deaths in the adult population that is still being analyzed by our medical examiner's office. But we were able to look at our juvenile and our young adult deaths. And I wanted to share this with you. Well, this isn't the one that this is just a previous snapshot. But the snapshot that, and I will be able to share it with you, that shows our juvenile overdose deaths is our juvenile under the age of 18. We have been able in the last 3 years to reduce those overdose deaths by 66%. Between the age of 18 and 24, we were able to reduce those deaths by 34%. Again, this is not because of the work of the initiatives doing, this is because of the work that you guys are doing. We just capture that information and really have that opportunity to highlight. And so I encourage you to go to the SUOPT website. You will have all the report cards, including the previous MSF and PDATF report cards. The report cards always go back 5 years, and you're going to get a really nice historical perspective. At our June 7th SUOPT quarterly meeting, it will be in person. It will be held at the San Diego Imperial Haida, and we will be looking at the first page, the key indicators of the 2023 report card. So next page, next slide. This is the two links that I wanted to share with you. Many of you have been amazing of getting our safe disposal location flyers and distribute them at all your events. And then we were able to take those flyers and we were able to identify safe disposal locations within geographic regions. And I remember one time meeting John Byron up in San Marcos in the rain and just giving him boxes of these flyers. But we wanted to let you know, and we will be creating a one-page flyer on this. It is now housed on the web. And so the Overdose Prevention, Safe Disposal, and Treatment Resource web map is an interactive web map that people can go to and put in within a mile radius, whether they indicate a 2 mile, 5 mile, or 10 mile. And they will be able to look at all the drop-off locations and then the substance use and medication assisted treatment resources, including where they can get naloxone and where our naloxone vending machines are at. And so we've taken this opportunity of putting things on flyers and put it on the web, and so people can access it right from their phone. So it really is a great opportunity to really share it electronically with all our families. Next slide. Now, this is similar to what we're going to do with the interactive web map, and I have to thank Kelly for this. This is a one-page flyer with a QR code that directs people to our website. On that website, guys, are flyers. Most flyers are translated in 5 languages, whether it's the words matter, what is substance use disorder, fentanyl, to what a parent needs to know about fentanyl. There are training flyers from the Good Samaritan training flyer to, video, to the video showing parents where kids may hide drugs within the room. There are the various toolkits, whether it's the methamphetamine toolkit or the fentanyl toolkit. So it is rich with resources. And this one-page flyer you now can take and print out both in English and Spanish to your events. And people can go right to that QR code and we'll take them to the website and they can navigate and get all those resources, including the Voices of Hope videos. Next slide. One of the things I think that the committees do so well within the SUOPT initiative is looking at current trends and what would be really important. Previous example would be, we were hearing about xylazine, and so we did a training on xylazine, and we got experts from outside the county that were in areas that were experiencing that xylazine trend to kind of share with us what's happening. We just haven't seen the levels of xylazine as other communities have, but I think it demonstrates that all of you really want to be up to the latest information, the latest trends. And so we're never caught like behind the eight ball. We're always there kind of understanding what's going on outside of our county borders. On that xylazine, we had over 800 attendees. So one of our partners said, you know, methamphetamine is still a very big issue, not only here in San Diego County, but in other areas. And so we are doing a training on methamphetamine. And again, we want to get outside San Diego perspective and then a San Diego perspective. And so Justin works with in Boston. He works for the Boston School of Medicine, and he's going to share with us information on stimulant use disorder and share with what they're seeing and then their treatment trends and what they're doing to support their community. And then we're going to bring it home with Alika, who is an MD here at San Ysidro Health. And she will share what she sees as San Diego County trends. Again, brought to me from you guys saying, hey, this is something that we need. And so a training has been developed. Next slide, please. Now, SUOPT is on social media, and Joe does a phenomenal job working with our social media, but our DEA partners sent out information on DEA takeback and also just ready-made stuff to post on social media. So I want to share it with all of you. It was shared with you via email, and it's here on this PowerPoint. So if you would like me to reshare, I would be happy to do that. But again, Take Back Day is this Saturday. Next slide. And then also on social media, you guys, I encourage you to go to the SUOPT website, and you can pull stuff off and post for your social media. IPS does a great job down in the South County. They put together a phenomenal newsletter, both in English and Spanish. And so I'm constantly sharing stuff and they're posting it. But within your regions, you can take anything off of that website and post it on social media or just share through email. But one of the things I want to encourage you to post is our Voices of Hope series. We've had really good feedback from the Voices of Hope series, and they are there for you to use. Next slide. I think that's the end. So, and then visit suopt.org.
Well, thanks, Marla. Last but not least, Craig Reed.
My apologies if my format's a little bit different than Marla and Joe's. The BUDI is going to continue to have some media that's going to be part of our efforts. And so just like Marla and Joe, we are moving to public health information away from media advocacy. That being said, we've been talking with our core extensively on how to approach this with the public health information strategies. And this is just a draft version, mind you, so we're still waiting to hear back from the core for approval. But these are the themes that we have come up with. And one thing I will make clear is that we're going to follow the core's directions of looking at showcasing data on these topics, but also what can communities do about this, which is the way in which we can talk about policy. So it won't be policy advocacy per se, but informing the community about the policies of which they can embrace or explore that will allow for community change on this issue. So with that, there's kind of 4 campaigns, if you will, plus the General Assemblies that will still be part of our deliverables. Please note that the General Assemblies, we're going to do a slight changing of the naming of it. As you all might remember, they're up until now, they've been called the Alcohol Policy Panel General Assemblies, and we're switching the name to BUDI since they have an interest in seeing it BUDI mentioned prominently and not the Alcohol Policy Panel any further. So the first one, and mind you, these are all dependent on when the core approves them, so these are just tentative dates. But we would definitely be exploring the social cost of alcohol, especially through social media. This is going to be a cluster of social media, possibly with a a more traditional media piece dovetailed in there that will be exploring these, likely pulling from a lot of the material that you got from the BUDI report card that was on display at the latest General Assembly, and you should all have a copy of now. It's also available on the BUDI website, which is budisd.org. And so we're hoping that you will all be interested in clustering with us as we've done before. These are meant to be shareable, so we will have this ready for you as soon as our core approves them. And then second clustering, of course, is going to be suicide prevention campaign. Definitely an important issue. We'll be looking to see if we can work with It's Up to Us as part of that, since they often have material on these topics around that time. And once again, we'll be trying to do a cluster of materials that can be shared and are via social media or be posted in traditional media. Joe already kind of beat me to it about mentioning, good grief, can't say anything correct today, the holidays. So we'll be definitely having something around the holiday season that will be part of our efforts. And then to wrap it up, we'll have an equity-focused campaign that's really focused into the impacts of which the BIPOC community faces from the fact that alcohol outlet density, especially liquor stores, are often higher in communities in which they live in. And as we've learned from Dr. Jernigan, that the BIPOC community tends to face more of the consequences of alcohol, the negative impacts, even though they're not necessarily the ones that are drinking the most. So very interesting how that happened. That happens and is still happening today. You do have access to the alcohol report card, as I mentioned, on our website, which just a reminder that the latest data on there is still predominantly from the pandemic era. So you're going to see expected upticks in drinking in many cases, with the exception of youth drinking, which made a dramatic downturn. I would not rely on that data as noting a significant trend line just yet until we have more data that confirms the trend line going up or its return back to a pre-pandemic level or something in between. So just be aware of that and take note of that as you proceed with your own media pieces. In addition to that, you should all have a video of Dr. David Jernigan's presentation, which and his slides. These are things that he is happy to share his information far and wide. As you know, he's an international expert on alcohol harm reduction and with a special emphasis on upstream prevention, which includes policy. So those are going to be great resources for you. One is there'll be one's on Facebook Live, and that will be there as a resource for you pretty much for as long as Facebook exists. And then Dr. Jernigan's slides should have already been received by you. So with that, as far as additional things to keep in mind that BUDI will be up to, the General Assembly, as you note on my screen here, we just mentioned that it's happening at this point approximately. The big thing that to keep in mind is that for us, most of the top speakers that we pull from come from the APs, the Alcohol Policy Annual Conventions. AP 20 is happening in May, so since it no longer lines up with our fiscal year, usually with back in the old days, it happened right before the fiscal year, so we have a pretty good pick of who we wanted and who was most lined up with the needs and concerns that San Diego County was facing as a whole. We kind of have a little delay now. So next month, we will have quite a few people attending, doing and listening in on a number of the experts in their latest research, and we'll be bringing that information back and proposing it to our core. So we'll make certain that we'll be in alignment with what your priority needs are. And there's also the survey that you all, many of you recently took at the last WCC meeting, which we were looking at different topics that most interested your communities. Most of these topics will probably be used for capacity workshops that you'll be able to take that information out into the community with and utilize within your media. A few of them, given the strong interest in them, may be upgraded to a General Assembly meeting, so we'll have more material that'll be much more robust in those cases. One of the things that's to be worked on in the fiscal year are going to be issue briefings, as well as packets that will be very helpful for you as far as your media work is concerned. So some of these are ones you probably will have seen before, but they need updating, for example. So we'll be freshening those up and delivering them to you, first getting your feedback on them in order to make certain that this aligns with what you can utilize the best. And then also ensuring that the once it's been core approved, ensuring that it's distributed far and wide through your media networks and outlets, so that way people understand what are the best practices, what does the science say, and what can they do to address these harms. And with that, I'm going to stop sharing.
I do have some closing statements. This does not mean that we're not doing media. This does not mean that we can't still attend everybody's media and even speak. I recently spoke on Friday at Rob Hall's Say San Diego news event. So we're still able to do everything we were before, with a few caveats. The other thing I want to mention is please remember to videotape using your phone any of these events. If media doesn't show up, one of us, most likely Bernard, can edit the video and try to put it on one of many websites, you know, especially to show the kids if you invite them to these events. You know, it's a little defeating to have them come and then nobody shows up. But that video should live somewhere on one of our social media sites so the kids can look back and even learn, you know, what things went right and what things went wrong. So all of us carry a phone, record the event.